Hi, this is Manos Brilakis from the Minneapolis Heart Institute, presenting an update on the Progress CTO Registry as of May 2018. Progress CTO is a multicenter international registry that provides information on chronic total occlusion interventions. In the last month, at the SCI 2018 meeting in San Diego, there was a late-breaking presentation by Peter Tighty on the outcomes of the Progress CTO Registry. More than 3,000 lesions in more than 3,000 patients were presented at 20 different sites, showing a technical success of 87%. The initially selected approach was successful between 50 and 60% of the time. However, after using different techniques, a final success of 87% was achieved. More complex lesions, as reflected by a higher JCTO score, had slightly lower success rate and required more often use of the retrograde technique and antegrade dissection reentry, and similar results were found when the Progress CTO score was used. However, even in the most complex lesions, approximately 80% success could be achieved. More complex lesions required more radiation as well as more contrast volume, emphasizing the importance of paying very careful attention to those parameters during CTO intervention. And the overall major complication rate was 3%, with the retrograde approach have slightly higher complication rates than the antegrade approach. There were many factors associated with success, with annual CTO PCI volume being one of them. So in summary, there is high success, acceptable complications, more volume is associated with higher success, and this is good benchmarks for discussing the risk-benefit ratio of CTO PCI with the patients. The paper was published simultaneously at the JACC Cardiovascular Interventions Journal with an accompanying editorial by Greg Stone. That was a major achievement. I would like to thank all the participating sites and the investigators for making this a reality. Another update on the new sites. We were fortunate to have 7 more sites join us since the last presentation. We first have Dr. Foruzande, Bezerra, Costa, and Pumipanit from Case Western Reserve University. Also Dr. Jay Katri from the Cleveland Clinic. Dr. Larry Van Thomas Kriskor from Memorial Hospital in Jacksonville. This is the first site in Florida. Dr. Bilal Malik from Maimonides Medical Center in New York City. Doctors Jefferson as well as Patel from TriStar Centennial Medical Center in Nashville, Tennessee, also the very first center from Tennessee in the database. Dr. Henry Meltzer from Trinity Medical Hospital in Buffalo, New York State. And Dr. Saik from WellStart Health System in Atlanta, Georgia. So we're very fortunate to have more sites, and we welcome all the sites and look forward to working with all of them. And this is the current overview of the registry with 35 sites, mainly in the US, but also some international sites. We would also like to recognize the highest enrollers during the past year. Number 1 was Columbia University Medical Center with Dr. Karbaliotis. Number 2 was the Mesalkin National Medical Research Center in Novosibirsk in Russia, with Dr. Kristianinov and Kemlitsky. Number 3 was Henry Ford Health System with Dr. Alasved. Number 4, Baylor Jack and Jane Hamilton Heart and Vascular Hospital in Dallas, Texas with Dr. James Choi. And 5th, Massachusetts General Hospital with Dr. Farouk Jafar. So I'd like to congratulate those top enrollers and thank them for their continued efforts in the registry. We also welcome a new member of the research team, the coordinating center, Dr. Iosif Xenogiannis, who just joined us from Greece and will be joining Peter Tighty and Bhavan Arangan in the day-to-day operations of the registry. Here's some new information on the database. We try to make Progress a living document and try to update it quite often to reflect changes in clinical practice. So included a new field for giving access through the distal radia or the radial snuff box. This is something increasingly being used, and we hope to understand if it's being used and how in CTO intervention. Also, we added new fields to determine how people are confirming distal true lumen wire position during CTO crossing attempts. Could it be done with contralateral injection, intravascular ultrasound, how the wire moves, or through monitoring of the pressure through the microcatheter? Well, it's some new fields regarding the use of retrograde techniques. Essentially, if the retrograde is successful, there's all these options. But in this case, even if the retrograde attempts was unsuccessful, there are still the options to describe which techniques were used, even though they were not successful in the end. Also, we added new fields regarding the type of contrast used and on whether the divert system from Osprey Medical was used during the procedure in order to save the contrast volume. There is currently 35 papers published from the Progress CTO Registry. And although currently still transfer using CDs, the online field transfer will be set up in the near future. Currently, the publications are listed in the Progress CTO website, progresscto.org, under publications, and also in the investigator part, which is for investigators only. Then we do have a full list of the papers, as well as the accompanying PDFs, as well as case report forms and resources for setting up the local patient log. There is also the Progress CTO website and the CTO manual website that has several of the cases from the CTO manual posted online with a search tool. And we look forward to working with you in the third edition, as well as the manual of non-CTO interventions. We also recently started the SIGN CTO study, which essentially is the orbita for CTOs. 15 sites are at various stages of startup and enrollment. And we would like to welcome anyone who is interested in participating in the study. The study does not have funding similar to Progress, but we're hopeful that with the dedication and the scientific importance of the matter, we're able to get this completed. And finishing up, these are some of the current work in progress. Long-term follow-up is an important component that we have limited information thus far. That's in part because of the design of the registry. We don't mandate follow-up, but we just collect whatever happens for standard clinical practice. But we still like to encourage all investigators to send us any information that are clinically collected during follow-up. There's also sub-studies in low ejection subgroup, access sub-study, previous bypass, what happens in STEMI non-STEMI patients, the new guide catheter extension reverse card, the performance of non-CTO interventions at the time of CTO PCI and on retrograde CTO PCI, and several other future directions. And we encourage all investigators to send us any information or any projects they would like to do for consideration. I would like to thank all of the investigators, the coordinators, the students, the fellows, everyone who has participated and continues to participate in the Progress CTO Registry, and invite you to continue this combined effort for understanding and improving the outcomes of CTO interventions. Thank you.